it was nice to really invest in her care. Like it was really nice to take it slow and really watch the progress that we had achieved together. And she's so thankful and she looks great. And her nerve damage has resolved a little bit, but we have an exact plan in place. Like we actually work with this counteracting muscle to help this side of her face. So it was a huge learning experience for me, and it was just a great outcome all around. So.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Stephanie Stewart, PAC, who is the powerhouse founder of the Aesthetic Method, a multi-million-dollar award-winning medical spa named Best Med Spa of 2024. After leaving a high-stakes career in emergency medicine, she turned professional adversity into purpose, channeling the trauma of a disfiguring car accident into a passion for transformative, confidence-boosting aesthetics. Stephanie is nationally recognized for her full-face injectable artistry and inclusive, client-centered approach. Her Detroit-based practice has become a gold standard in the industry, redefining beauty and empowerment for thousands. So Stephanie, welcome and glad to have you here.
No, thank you so much for having me.
Yeah, so let's dive right into it. I want to know, how did you first get interested in aesthetics? And I'd really like to hear, in the introduction, you talked about that car accident that you had. So could you talk a little bit more about that? I'd like to know your background, your story.
Yeah. So I'll start with the car accident because that kind of starts my medical professional career and then kind of how I accidentally got into aesthetics. So when I was 15, I was on my way to high school. I did not drive yet, so I was in another person's vehicle and I was sitting in the back seat. Never didn't wear my seatbelt, but that day, for some reason, wasn't wearing my seatbelt. We hit head on with another vehicle due to like a blind spot, and I actually went through the windshield. So I was ejected, and didn't lose consciousness. I was awake the whole time. I remember everything, but I didn't realize like the severity of what had happened until they pulled me out of the vehicle. And so I remember sitting on the curb waiting for the ambulance to come, and I remember like touching my face and being like, "Oh, this doesn't feel normal." And so I suffered multiple facial injuries. I was transferred to a trauma center and then to another surgical center where they could work on my injuries. And so luckily, nothing was involved from the neck down, especially not wearing your seatbelt and being ejected from a vehicle. So as a 15-year-old girl, you definitely do not want your face to be disfigured. And unlike breaking a bone in your arm, leg, etc., you don't just put a cast on these things and wait for it to heal. It was years and years of reconstructive surgeries, dental work, and I never look back at that time and think, "Oh, I'm so upset that that happened to me," or "Why did this happen to me?" Because it really led me to go into the medical field. I remember all the medical providers that I had dealt with really making me feel good about, you're going to be okay, and this is all just temporary. And I really wanted to make others feel like that. So that's why I decided to go to PA school. So I went into PA school. Right out of college, worst 2 years of my life, but I'm thankful it's done and over with. And once I was out, I actually wanted to go into trauma. So did that, worked in the ER for about 6 years pre-COVID. So I didn't even get to experience much of COVID. And I just realized that it wasn't what I thought medicine was going to be. It was a lot of politics, and it didn't feel rewarding. I didn't feel like I was giving people what those medical providers gave me. And so I decided to pretty much leave medicine altogether. The only saving grace was like, I actually can't leave a high-paying job because I need to pay off my student loans. So I started getting certified in injectables, if there is actually a certification, if you will, hoping that a dermatology office would hire me, and they didn't. So when I say I mistakenly fell into this field, I literally Googled one day how to open my own business. So I had never taken a business class, never aspired to own my own business, and definitely did not think I'd be working in injectables. So that is your intro of how it happened.
Wow, that's incredible. So do you think that because of that car accident, were you already interested in medicine before that? Or do you think that, and it just the car accident just solidified that you wanted to go into medicine? Or was it after that you think that really kind of started leading you in the path of wanting to go into medicine?
Yeah, I think my parents instilled it in us at a young age, like kindness and always helping people less fortunate than us. So I always wanted to do something that I could give back and help people. but you're 14, 15, you have really no idea what you're going to do. So that really kind of launched me into wanting to help people more and more so defining like, okay, I should go into the medical field. This is where I'm going to help people the most from my experience.
Got it. Now, Stephanie, I want to dive a little bit more into now that you have your practice set up and running
Yeah,
it. It's one of the top ones.
yeah,
What are some of the most common treatments that your clients come to you for, and also why do you think that they're so popular?
sure. So we strive to really stay on the medical side of things. We are classified as a medical spa, but we're not really spa-like. So what I mean by that is we're not offering relaxing facials or services like that. Instead, we're offering more result-driven procedures. So we do a ton of botulinum toxin injections, dermal fillers, a lot of regenerative treatments, which I think the field of aesthetics is going towards. So that's like NAD, Sculptra, PRF, and then we have our estheticians run our lasers and our skincare treatments. So the most common requested procedure for us is probably just a toxin injection. I think people don't see it as invasive as the other procedures we offer, so it's kind of like they're dipping their toes in the water with that, and that's what's most requested for us. And I think Botox, the brand, has just done a really good job in marketing what they do. So we don't just offer Botox and brand, we offer multiple that are on the market, but I think that's the most common that's requested for sure.
Okay. Now, you're mentioning regenerative medicine, and you mentioned that this is probably the direction that
Yeah,
medical aesthetics is starting to go in. So
for
can you
sure.
talk a little bit more about regenerative medicine, what it is for people that don't understand it, and
Yeah.
why you think it's now starting to get more and more popular within the medical aesthetic space?
For sure. We've had Botox and fillers for a long time. I mean, this industry is fairly new compared to any other medical field, but we've had those for a long time, and I think they've gotten a bad rap, unfortunately. People looking unnatural, and I think a lot of TikTok influencers has convinced people that these things are bad. They're toxins. You're putting something foreign into your body. So I think consumers have really done their homework of what can I do that is natural, using my body's own building blocks, and not making me look weird. And we never make you look weird, regardless of what we're doing. But I do think that people are looking for those types of treatments, something that we can jumpstart your body into doing what it used to do. It's just not used to doing that anymore. So after the age 25 to 27, you're no longer making collagen elasticity. And our demographic is usually 30 to 50 years old, female generally. We do see a lot of male clients as well. And so these women have been years without making their collagen elasticity, and they're starting to notice the aging. I also think that people are really into preventative care, and social media has been really on our side for helping our business be successful. So I think people are just looking for what they can do that's more natural and using their body's own building blocks.
Got it. Now, are there any emerging treatments, whether it's within regenerative medicine or even
Yeah.
maybe outside of regenerative medicine, that you're particularly excited about?
Yeah, so I'm super excited about NAD. So NAD is a vitamin derivative that we all have in our body. As we age, it decreases, like most things. And so NAD has been studied for about 80 years now, but I would say in the past 5 to 10 years has become easily accessible to give to consumers. And so they've actually done a couple studies where it showed it would prolong your lifespan by 7 years if taken consistently, which I mean, everybody's looking to live longer. But even besides that, people want to look good if they're going to live longer. So it's really anti-aging from the inside out, and it's using your own body's products. It's replacing what you've lost. So everyone on my team does it. We're all addicted to it. It doesn't have addicted qualities. I don't want to scare people, but we're all addicted to it because we know how good we feel on it. The mental clarity, the less brain fog. We all wake up really early and go do our workouts, and we're not groggy. Especially being a lot of us are moms, so we're just tired all the time. And so it's really helped. And I'm excited to see, the anti-aging benefits from like an aesthetic side of things. So I'm really excited about NAD.
Okay. And you did bring up this one point also earlier, as far as people looking for a little bit more natural look.
Mhm.
I've been talking to a lot of providers in the space, and it seems like
Yeah,
what they're seeing is this trend of people wanting more and more of that natural look, not the
for sure.
job look anymore. Are you seeing the same thing in with your clients? And also, why do you think people are starting to make that shift?
So I think we've done a really good job at branding ourselves as we approach the face holistically as a whole, and because we believe that a little bit everywhere looks a lot a lot better than a lot in one area. And so we've done a really good job at branding that. And so a lot of our new clients come in for consults to seek that. And they kind of know us, like they know they're not walking in and getting lip filler. That's just like we've done a really good job at that's our brand. Doesn't mean we don't ever do it. It just means we don't jump right to it. And I think people trust us in that because they see our before and afters, they see that that is our method, and they're coming to us and saying, okay, what do you want to do to my face to keep me looking natural? I think they're trusting us. And it wasn't always that way. I mean, it took us years to build that brand, right? But now that's really the demographic that we attract.
Okay. Now, I want to hear in your own words kind of how you were able to differentiate your practice from others in the industry. So, in the introduction, you mentioned that you were the best med spa of 2024.
Yeah.
I know that you built an amazing team. So, can you talk a little bit more about really how you were able to do that, build your team, really set yourself apart, and get that award?
There's a couple reasons. So one of them is we are located right outside Detroit in a town called Ferndale. And Ferndale is a very inclusive place. It's known for LGBTQ rights and a lot of small business owners. And I think in this day and age, people really want their money to go to something good. And so they see that we are not only involved in our community, but we're inclusive and we're always giving back. So we focus really heavily on dog rescues. That's my passion project. And female rights as well as other like female-owned businesses. So I think our clientele sees that we're not just here to drive revenue and sales, that we, yes, we are a business. If not, this would be a hobby, right? But we have to make money and we just take that revenue and we invest it into something bigger than us, right? So I think that's number one. People want to see their money going to something like that. And then number two, it was again, it wasn't always like this, but we're really lucky that we don't need every client's business that walks in the door, so we're able to say no. And I think that differentiates us from other practices because we've developed such a successful business now, and I can turn people away if they're looking for something that doesn't match our brand. So if they're walking in really want something unnatural or unrealistic or just something that's not on par with what we do, we can say no. And I think that sets us apart because it builds trust too. Our patients that come in and say, "Oh, just a little bit more, a little bit more." And we're like, "No, you don't need more." I think that builds trust because they're like, "Oh, they're not just taking my money, they're actually being honest with us." And that's across the board for all my providers at the practice. So I think there's a couple reasons why people have trusted us and why we won last year because it is a voting. So we won because people voted for us, and we're very thankful for that.
That's great. Now, I want to dive a little bit into how you built your team because
Yeah.
as a business owner, it's not easy to bring
No.
team members. It's not easy to set the right culture. I know we discussed before we started recording was that you have very low turnover, which is
Yeah.
any business, not just medical aesthetics, but any business that is an accomplishment. So,
Yeah.
can you talk a little bit more about how you were able to set that culture, how you were able to attract the right people, and have this amazing team?
I didn't just hire, we're a team of 10. We didn't just hire 10 right off the bat. We built slowly. So I literally had a cubicle space that I rented out and I worked by myself for a year or two. And then I hired an assistant, then I hired another injector and kind of just built from there. But no one that I've ever hired has ever been experienced in the role, meaning I've never hired an experienced injector. I've never hired an experienced admin staff. Everyone that I've hired, I've given them the chance to build and grow in the company. And I think people like that opportunity, right? They know that I'm going to invest in them and that they're going to be part of the building of it. So I think people look on social media and they think like, oh, they're such a great team and they all get along and they all hang out and that's great. But it's so much deeper than that. I invest so heavily in them and they're part of decisions, big decisions that are made. And I'm also in the arena. I'm not just the business owner, I'm working in the business. I am an injector. I do see patients, and I'm not making decisions from outside the arena. I am in the business, in the arena, making decisions. And I think that really gains some respect with my staff. And you have to treat them. If we ever have extra revenue, it's going to go to them because I know if I invest in them, and the money not may not be everyone's driving motivator, but if we have anything that comes out of more success from the business, I'm always investing it back in them, whether it be their education, whether it just be like something nice that we do for them, or even, increasing their wages. But they know that if they work hard and the business does well, they will also do well. So we just started that culture from day one, and I think it's really helped us out.
Yeah, well, I think it speaks volumes to your leadership because when people outside, like the outside looking into business owners' life, they're like, "Oh, well, you have a successful business, and you just must be this outlier," or
Yeah,
whether you're a good leader or not. But I think what really is the defining factor is when your people stay with you for a long time,
for sure.
the litmus test, and you've achieved that. So I think that's
Yeah.
a huge differentiator in your practice, and I can start to see now why you have separated yourself out from the others and why you won that award.
Thank you. I appreciate it.
Yeah, now Stephanie, I want to dive a little bit more into the client side of things. So I want to, how do you approach educating your clients about the services, the treatments that you offer, and the benefits? Like, what's your general
Sure.
approach to that?
Sure. So we have two consultation pathways. So one is an injectable pathway, and then one is a skincare/laser pathway. So if you're coming in as a new patient, we always recommend you do a consultation. We do charge a deposit, and I know some med spas don't, or some people might be like, "Oh my God, you're charging a deposit," but it really does weed out people who are not serious. And that deposit, we don't take that deposit, it goes towards your treatment, but I think it's worked really well for us. So if there's any med spas that are listening, I do think you should always implement a deposit. Um, if patients are coming in for injectables, they'll see one of our injectors. We all accept new patients, and some are a little bit more available than others. But so you'll come in and we do our full face assessment. That's kind of like our method that we've ran with for the past couple of years. And so you come in and we'll talk about all the modalities. It's a ton of information. People leave being very educated. It's a half hour to 45-minute consultation, and we are writing everything down as well. That gets scans into their chart, and they also take that paper home. And not only does it walk through what we recommend in terms of toxin, filler, bio stimulators, regenerative medicine, but it also talks about their plan. So I always say, let's not jump in. We're not sleeping together on the first night. Let's date a little bit. Let's get to know each other. Trust me. I want to make sure you're a good fit for us. And then you come in every so often and then we achieve your results. I don't see a lot of patients that we do everything in one day and then I never see them again. So we'll really map out their timeline. You're going to get Botox every 3 to 4 months. You're going to do Sculptra around your birthday every year. And that way they have a plan in place. We also walk through their whole face with them. So I'll teach them about the aging process. I'll say, okay, this might not bother you now, and I don't see this being an issue. But you're going to look out for this. So when it starts to bother you, okay, Stephanie told me that this is what I could do to help it. And I really teach them about balancing. Facial balancing is, a trending word for the past couple of years. But once you teach patients and help them understand what facial balancing means, they're like, oh, okay, now I get it. And then we have a whole portfolio before and afters that we show people because I do think it's a visual business and they need to see your results. And similar pathway for our skincare. We have a Vizia machine, which I'm sure most people are aware of if they're a med spa owner, but it analyzes your skin at a microscopic level and really shows people what we're looking at. And then our estheticians will walk you through the best skincare routines, because skincare is 80% of what you do at home, or anti-aging is 80% of what you do at home. And then lasers and any other skin treatments we offer. So same thing, timeline, plan. We teach them everything they need to know about it, and they leave very educated with a lot of information. So we always say, we know this is a little overwhelming. You can always come back and ask questions. We're always available if you need more. But we really, really invest in that consultation for sure.
Got it. Now, you did touch on this a little bit earlier, but I'd like to dive a little bit deeper into what enough looks like. You kind of mentioned that you're
Yeah.
not going to tell people like, oh, you're like, it's good, like you don't need any more. So,
Yeah.
this being again on the topic of education, can you dive a little bit deeper into like that concept of what is enough?
Mhm. So one of my phrases that I use a lot when I'm doing the consultation is, let's use filler, for example. I'll say I use filler for two different reasons. One, to replace volume that you've lost since you were 27, stopped making collagen elasticity, and I use it where you didn't have volume to begin with from a genetic standpoint. So some people genetically have recessed chins, and so we use filler to build out that chin. But I'm never using filler to make something that you never had, unless it's the genetic thing, because that's when you start to look weird. So if you never had volume in your cheeks to begin with, we're not making you have these huge cheeks. And I think the same thing goes for toxin. People won't believe this, but it's actually a lot harder to make you look weird with toxin than it is to look make you look weird with filler. So that's kind of how I approach the filler aspect. With toxin, it's just, I don't want patients to come in every 3 to 4 months. I don't want them to come in any more than that. And then if they come in at 3 months and there's still not a lot of movement, I'm like, save your money. I'll see you back in a month, or wait till this wears off. So I think it's just making sure you're honest with people and not just taking their money to take it. And we all think we look natural in the practice. So I'm going to recommend what I would do to my face to people. So if I walked in someone's office, injector's office, and I was still really frozen from Botox, I would hope that they would say no to me. So we kind of take that approach.
Got it. Now, I'm sure that you have a lot of misconceptions that people come to you with.
Okay.
So, what are
Yeah.
the most common misconceptions that you hear about the treatment
Yeah.
you provide?
Oh, so many. So people are always concerned about a reaction to Botox. And when I say Botox, I do mean botulinum toxin. There's many on the market. I think there's six actually that are FDA approved in America now. But people are always worried about a bad reaction from botulinum toxin. And I tell people it is a drug. It is an FDA approved drug that we're using. So yes, there are risks, but they are very unlikely. And as much as I love TikTok, boy, oh boy, do I hate what happens on TikTok in terms of like influencers spreading their bad results because it's like it's fear mongering. Like people are going to think that's every patient that comes in. So a lot of misconceptions is that they're going to have a bad reaction to Botox, and I can honestly say I've never experienced like allergic reaction or a bad reaction to anyone that we've injected with botulinum toxin. The other misconception is everybody thinks filler is taboo. People think if I put one drop of filler in you, you are going to look weird. And that's just not the case. You start to look weird when you do a lot of filler in one area. You actually look way less weird and more natural and more balanced when you put a little bit everywhere. So I think people get scared when we say that, okay, you need 5 syringes of filler. Well, 5 syringes of filler, it's only 1 teaspoon of volume. It's really not a lot. So when I'm doing 5 syringes over your entire face, it's 1 teaspoon of volume that we're making look good by doing a little bit everywhere. So I would say those are the major misconceptions. And I think we haven't actually had a lot of time to make misconceptions about the regenerative medicine. So I think that's why a lot of people are interested in it too, is they're not seeing too many bad things on the internet yet about it.
Yeah, I mean, aside from the FDA being really, really
Yes,
slow with approval, but
right, right.
I remember back in the day when it was new, and there were some like the pioneers that were getting into regenerative medicine. This was maybe 4 years ago, and back then it was like FDA is like, nope, like not
Right,
happening. But now it's
right.
they're starting to open up a lot more medical spas are getting into, which I think is great. I think it's
Yeah.
an amazing treatment that's on the horizon for us.
I do too. I wish there was a little bit more regulation in terms of like medical spas, because I feel like anybody can, if you have a medical degree, at least in the state of Michigan, if you are a nurse, PA, nurse practitioner, dentist, or physician, you can inject. So, I mean, and there's not really a lot of regulation. I mean, look at what I did. I mean, I went and took a weekend class and then I could inject. I mean, that's not really great. Like I definitely should not have been injecting then. And I did take it into my own hands as I grew and grew and grew to hire other experienced injectors and go shadow them and train with them and invite them into our office. And so I've invested so much money into my own education as well as my teams, but that's just because we wanted to be the best. It's not because it was regulated to do that.
Okay. Now, yeah, I think it really comes down to people being aware of who is the right ones to go to in the marketplace and who has that experience, who has the credentials, and who has that credibility. So
Yeah,
I think that's a
for
big
sure.
part of it. Now,
I do have a soapbox about who's credible not to do this. So, a lot of my patients are like, oh, well, I went to a dermatologist for it, or oh, I went to a plastic surgeon for my injectables. And great, I know a ton of really good dermatologists and plastic surgeons that are really good injectors. They're great. But you have to remember that that's not always their bread and butter. And you definitely don't want me doing surgery on someone, and you definitely don't want me diagnosing rashes. So, this is all we do all day long. And so we see any complications that may arise. We see the best results. We try all the different products. We're not just investing in one company's products. And so I think as a consumer, you should understand that just because they have dermatologists on their sign or plastic surgeon, they might not be the best injector. They could be, and again, I know a ton, but it's not just a given that they're good at that.
Okay, so that sounds like another common misconception that people have
Yeah.
about
Yes,
who does you go to.
for sure.
Okay. Now, Stephanie, for my next question, I'm really curious about how you'd answer this because you have this background in emergency medicine. And when people think about medicine, they think, okay, there's a protocol, there's a procedure in place.
Yeah.
But what role do you believe creativity plays in how you approach patient care?
Yeah. So this is actually what like drove me to go into this field a little bit when I was thinking about leaving ER. I was like, man, what can I do that's still in the medical field and will allow me to pay off these student loans, but also like express my creativity. I remember as a child, like I was always creative. I was always building stuff and making so many things for my dolls and like the most elaborate doll houses you've ever seen, right? And so I remember thinking when I was in the ER, when was I like the happiest in my life? And it was whenever I was creating, whenever I was really like expressing artistry. And I'm not an artist, like in terms of I don't paint or draw or anything like that. But so that was like one of the driving factors where I was like, you know what? I can combine medicine with artistry, if you will, creativity. And that's exactly what aesthetics is. And it's funny that you asked me that question because one of my interview questions for hiring providers is, what do you do that's creative? So I hired an ICU nurse that was a nail tech at one point. And so she had drawn these intricate nail designs and she was very, really good hand-eye coordination. I was like, yep, you're the person. And then another injector I hired, she made handmade gifts for everybody on Christmas. So I was like, yep, you're my person. So, and they are, I'm not just saying this because they are part of our team, they are some of the best injectors that I know, hands down,
Okay, so yeah, so creativity plays a massive role
for
in
sure.
success of the practice.
For sure.
Okay. Now, Stephanie, I'm sure that throughout your experience and through the life of the business, you've run across some challenging cases. So, would you
Yeah.
mind sharing a story of maybe one that comes to mind, a story of one that comes to mind of a really tough case that came in and how you were able to get them a successful outcome?
Yeah. Oh God, there's a ton. Let me think where I want to take the direction. So we can either talk about vascular occlusion, we can touch on that if you want to, which is a rare but very serious complication. Or we can touch on a patient that had disfigurement from cancer, actually.
Okay. Let's
So
do that
your
one.
choice.
Let's do that one.
Okay. So I had a patient that had a malignant tumor in her, I believe it started in the base of her tongue. And when she went to her dentist, they found a spot, had it biopsied, and it came back cancer, and it was pretty aggressive cancer. So she not only had to have part of her tongue removed, but she had a lot of her mandible removed, a lot of soft tissue in her neck, and thus she had a lot of nerve damage in the side of her face. So we know nerves talk to muscles, and that's how they contract and work. And Botox also works on muscles by stopping the contraction and relaxing the muscle so it can't pull on the skin. So you can see when this patient comes in, I'm like, oh my gosh, what do we do? Because she can't move one side of her face. If you've ever heard of Bell's palsy, that also happens where the nerves are affected on one side of the face and almost looks stroke-like. And so, one, I have to decide as a medical provider, can I treat this patient? Is she from a health standpoint and from a cancer treatment standpoint, like, are her oncologists okay with this? So there was a lot of, discussing with her oncology team, is she ready for this? I mean, she was no longer receiving treatment, but she was 6 months out. Like, is she ready for aesthetic treatment? Because at the end of the day, this is elective. This is a luxury procedure, right? So one, is she ready for this treatment? And two, what the heck do I do on the one side of her face? So and they did tell me, her oncology team did say, actually it was her surgeon, these nerves can regenerate. And so then I have to worry about that too. I'm like, okay, well, I'm going to Botox one side of your face, but I got to worry about when these nerves are coming back. Are they coming back next week? 3 months, 4 months? So I think the best thing I did was just go really slow with her and be like, okay, we're gonna treat this area today, and I'm gonna see you in 2 weeks, and okay, we'll treat this. And I don't normally do that with patients because you can build a resistance over time, exposing them to toxins over and over again. But I think just it was nice to really invest in her care. Like it was really nice to take it slow and really watch the progress that we had achieved together. And she's so thankful, and she looks great. And her nerve damage has resolved a little bit, but we have an exact plan in place. Like we treat this side and we do this to this muscle, and we actually work with this counteracting muscle to help this side of her face. So it was a huge learning experience for me, and it was just a great outcome all around. So
That's a fantastic story. And I think I always like hearing these stories because I think it really validates my thought process when it comes to aesthetic medicine, like the industry as a whole. Because I think a lot of people who don't know much about the industry think about, oh, the aesthetic industry is all about just vanity and just trying to
yeah,
maximize your beauty and all that. But when I ask this question, as far as like, what's the story that really resonates with you? Almost across the board, it's almost always a story of someone they're helping someone who just wants to feel normal again,
yeah,
just wants
yeah.
to get back to being their best self. It's not about, I want to be the best looking person in the world. It's just, I want to be normal. I want to be who I really am.
Right. And I think that's why a lot of our demographic is moms, new moms in particular, is a lot of things happen when you go through pregnancy and becoming a new mom. And I think people just want to feel better. They just want to feel like themselves again. And like even leaving the baby for the first time. I have patients that come in, they're like 2 weeks postpartum, they're ready to get back to it. But it's like a whole, like we're very grateful that we get to experience that time period of their lives with them, which is like a special time for them, where they're leaving their baby for the first time. They're getting out, they're feeling themselves again, they're doing something for themselves, they feel confident because they're looking like they used to again. And so I really take a lot of pride in being able to be part of that for them.
I can tell in your passion. I can tell in
Yeah.
the stories that you tell. Now, Stephanie, we talked about this a little bit already, but I want to dive a little bit more into where do you really think the future of medical aesthetics is going? Like you talked about regenerative medicine, we talked about kind of that natural look, but where else do you think aesthetics is going to go in the future?
Yeah, so I think a lot of people have probably heard of like red light therapy. And these masks at home, which if you are a consumer, and I don't know if you've interviewed someone on these, but they actually do work. They're not going to replace botulinum toxin injections or, volume. They're not treating volume loss, but research has actually shown that red light therapy does work. So those masks that you're spending hundreds of dollars on, they're fine. You can use them at home. I don't say that about everything, but that is research back. So I think a lot of it's going to be something similar to that. I think LED light therapy is really a hot topic right now, especially there is a bed called a stim bed, and where patients, or a lot of athletes are coming in for it, and they actually have them in their homes because they can afford these beds. But think of it as like a tanning bed where you're laying on, and it's LED light therapy, not red light therapy. And so not only is it healing, it's FDA cleared too, but it's supposed to be helping with cell turnover and therefore helping injuries, and people just generally feel better. And then they don't have clearance for this, but it is doing some anti-aging properties. So I think we'll see a lot of light therapy in the future.
Okay. And there's this, I guess this movement of biohacking where people
Yeah,
are trying to extend their longevity, but also increase their quality of life. So
yeah,
part of it is aesthetic, but a lot of it is also just kind of like you mentioned, like kind of fixing the inside and then that it's being
mhm,
reflected on the outside. And I'm
yeah,
starting to see a little bit more of this shift in medical spas that is diving a little bit more into the wellness side, whereas before, like traditionally, 10, 15 years ago, it was really just the pure outside aesthetics. So
right.
do you kind of see that trend continuing where medical spas are going to start to get a little bit more into the wellness side, like the internal wellness side, along with
For
the
sure.
external?
Yeah, for sure. I think, I can speak to both sides of medicine because I'm a physician assistant. I studied Western medicine, and a lot of Western medicine is diagnose and treat the symptoms. It's not like find out what the cause is. And so I think a lot of people are taking their frustration from modern day medicine, where it's just medication and pharmaceuticals and surgery, and they're actually investing in more naturopathic pathways or doing these biohacking things where they're teaching their body how to use the tools they already have to feel better, look better, and ultimately heal. So I think it's going to be really interesting because, again, you have to be a medical provider to provide these therapies and treatments. So we're all Western trained, but we're also going to be like diving into this now field of really figuring out what is happening. Like, why are these patients having these symptoms? Why are you having this pain and what? And I don't know if med spas will go that far down the road with it, but I do think that people are frustrated with modern day medicine and they want their bodies to heal themselves. So it'll be interesting to see.
Awesome. Well, Stephanie, I have one last question for you, but before I ask it, I want to point people to your website at www.theaestheticmethod.com. Now,
Thank
last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure or aesthetic treatment done, but isn't sure which provider to choose? And we kind of talked about this earlier, but I'd like to give you the
you.
time to kind of dive a little bit deeper into that.
Yeah, so I think there's no harm in going to multiple consultations. I think that you have to know that they're a right fit as much as, they're marketing to you. You need to make sure that they're a right fit for you. And then look at their team, see how their team looks. Is that something that you want to look like? If they're overfilled and overinjected and you're kind of like confused of what's going on, probably not a good sign either. And then see how much they push you to get something done. I really take pride in my whole team being like this, is we will give you all the information. We will educate you on the treatments, the services, and how to achieve the best results. But we're never going to make you buy it. And we're never saying, well, you have to buy it today, otherwise you lose this deal. Like I mentioned earlier, we're able to say no. And I think that really gains trust with our patients. So look out for that too. See how pushy they are, because if they're pushing you, they need the business, which I think speaks volumes of where they are in terms of their offerings.
Got it. Well, there you have it. Stephanie sharing her expertise. So, Stephanie, where can people contact you in your practice?
Yeah, so we are big on social media. We're trying to get better at TikTok. I mean, I love hate with TikTok, but the most heavily prominent way that we're seen is on social media. So Instagram, and it's our name of business, the Aesthetic Method, and we do some fun stuff, but we're pretty educational on there, and that's what our clients give us feedback on is go to your Instagram, or we love going to your Instagram and seeing your education.
So, well, Stephanie, great having you here, and thank you for sharing your message.
Thank you so much for having me. I really appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.